Hello everyone and welcome to a new video. So continuing our discussion about antibiotics, now we are going to talk about the tetracyclines. The tetracyclines are also from the protein synthesis inhibitors. They are discovered in the 1940s and their name tetracyclines originates from their structure. The tetra meaning 4 and cyclines meaning rings. So they contain four rings and they also contain many OH groups, making them water soluble, and they also contain an amine group. In this video, we will talk about the agents that are from this class, and we are going to talk about the pharmacokinetics of these agents, the mechanism of action, the spectrum, the resistance, the therapeutic uses, and the adverse effects. So let's start. So let's start by mentioning the agents that are from this group of antibiotics. We have the oxytetracycline, this drug is of half-life of 6 to 12 hours. We also have the doxycycline. Doxycycline is the most important and the most used tetracycline available, so important and most used, and it is of a half-life of 16 to 22 hours. We also have the minocycline. Minocycline is of half-life of 16 to 18 hours. And finally, we have the demeclocycline. Demeclocycline is of half-life of 12 hours. Now let's talk about the pharmacokinetics of the tetracyclines. First of all, let's talk about the administration. So the absorption of the tetracycline is incomplete. So absorption incomplete because of the high water solubility of the tetracycline, because they contain many OH groups, and remember that the oral absorption prefers the lipid solubility of the drug. So if the drug is more water soluble, the oral absorption is going to be incomplete, and that's the case of the tetracycline. So absorption incomplete because of high water solubility. We also have when there is administration with another substances that contain multivalent cations, this would lead to formation of chelates and there is less absorption. So administration with substances containing multivalent cations like the aluminum, the magnesium, the iron, and the antacids will lead to formation of non-absorbable chelates. and would decrease the absorption of the tetracyclines. And this is solved by spacing by a half hour between the food intaking that contain these type of cations and the tetracyclines intaking. So half hour spacing is a solution to this problem. All of the tetracyclines are available in oral formula. So are available in oral formula. The doxycycline and the minocycline available intravenous formula as well as the oral formula. So available intravenous. Now let's talk about the distribution of the tetracyclines. So distribution. First of all, the molecular weight for most of the tetracyclines is less than 500. So molecular weight less than 500. They can't, or they cross the blood-brain barrier, but in low concentrations. Except for the doxycycline and the minocycline, which can achieve therapeutic levels in the cerebrospinal fluid. Achieve therapeutic levels. They have good penetration to body fluids, so good penetration to body fluids like pleura, prostate, and other body fluids. They cross the placenta, and they make complexes with the calcium, and they would make malformation of the bones of the fetus. So they are contraindicated in pregnancy. So cross the placenta and form complexes with the calcium, leading to bone abnormalities in the growing fetus. They are also not given to kids less than 8 years, not given to kids less than 8 years of age, because they cause abnormal teething to the growing child. They cause abnormal teething. They cross into the breast milk, so good concentration in breast milk, but they are contraindicated because of the same problem of making complexes with the calcium and causing abnormal teething in the growing child. For the metabolism is in the liver. For the excretion, most of them excreted by the kidney, most excreted by kidney mostly, and some excreted in tears, bile, and sweat. The doxycycline have a different modality of excretion. So doxycycline is half excreted by the kidney and half excreted by liver. So it can be given in case of renal insufficiency, and the part that is excreted in bile, so the part excreted in bile reabsorbed again by the enterohepatic circulation, and this would cause liver toxicity with long regimens. So excreted in bile, reabsorbed by enterohepatic circulation. Now let's talk about the mechanism of action of the tetracyclines. The tetracyclines, as we mentioned before, is from the protein synthesis inhibitors, and we have two types of the subunit of the ribosome of the bacteria. We have the 30S subunit and we have the 50S. The tetracyclines bind into the 30S to 30S by weak and reversible bond, and that would make them bacteriostatic even in high concentration. In comparison with the aminoglycosides bind to the same ribosomal subunit, the 30S, but they bind by strong bond, and that would make them bactericidal in comparison to the tetracyclines. Now let's talk about the spectrum of the tetracyclines. The tetracyclines have a very broad spectrum, so very broad spectrum. They work on the gram positives, except the staph, and the gram negatives, except for the Pseudomonas. They also work on the anaerobes, except for the C. Clostridium difficile. They also work on the atypical microorganisms, including the organisms collected in the mnemonic calm, my leg, calm for chlamydia, my is for mycoplasma, leg for legionella, and they also work on the atypical microorganisms collected in the mnemonic BRC. The B is for Borrelia, the R for Rickettsia, and C for Coxiella. And we will discuss each of these organisms in the therapeutic uses, including what infection each of these organisms cause. And the tetracyclines also work on the parasites, including the toxoplasma and the anti-amoeba histolytica. Remember that the parasites, they have ribosomal subunit, same as the mammalian cells. So they would have the 40S and the 60S, and in case of the parasites, the tetracyclines work on the 40S. Most of these organisms gained resistance against the tetracyclines. So most organisms gained resistance. So we don't use the tetracycline as a first line for most other infections, but we will talk when we use them as first line in the therapeutic uses of this presentation. Now let's talk about resistance against the tetracyclines. We have different resistance patterns against the tetracyclines. We have the presence of efflux pumps that expel the tetracycline out of the bacterial cell. So first, the efflux pumps. And we also have production of enzymes that interfere with the binding of the tetracycline to the 30S ribosomal subunit. So enzymes interfere with the binding. And finally, we have the enzymatic inactivation of the drug. So enzymatic inactivation of the tetracycline. Now let's talk about the therapeutic uses of the tetracyclines. First of all, they are used to treat the calm-my-leg infections. So calm-my-leg infections collected in this mnemonic. The calm is for chlamydia. The chlamydia cause eye and genital infection, and it is considered an STD. The my is for mycoplasma. Mycoplasma cause a typical type of the pneumonia, so it is called mycoplasma pneumonia. And the leg is for legionella, and the legionella is cause the Pontiac fever and the Legionnaires' disease, and both of those are respiratory illnesses, and all of those are treated with the macrolide as a first line. So first line macrolide or macrolides, and the second line is the tetracyclines. They also used to treat the BRC infections. BRC, the B is for Borrelia. Borrelia causes Lyme disease, Lyme disease. Lyme disease is spread by ticks, so spread by ticks and characterized by a spreading rash called erythema migrans. And this is treated with the doxycycline for 14 days, so doxycycline. The R here is for the rickettsia. Rickettsia causes different types of spotted fevers, including Rocky Mountain spotted fever and the Mediterranean spotted fever. So different types of spotted fevers, and they also cause scrub and epidemic typhus. So scrub and epidemic typhus, and those also treated with doxycycline or tetracycline in general. So tetracycline in general. The C is for the Coxiella. So let's do this. So the C is for Coxiella. The Coxiella causes Q fever, and this is also treated with the tetracyclines. And those all are, the first line is tetracycline, and the second line is macrolide. So it is the opposite of those. The first line is tetracycline and the second line is macrolide. Also, the tetracyclines are used to treat the cholera infection. So cholera infection it is caused by Vibrio cholera bacteria, and it causes abdominal pain and watery diarrhea, and the symptoms ranging from mild to severe, and it is treated with doxycycline, 300 milligrams single dose. It is also used in treated secondary infection that occur with the acne. So secondary infection in acne. The doxycycline is used because the doxycycline is excreted in sweat. The tetracyclines are used to treat primary and secondary syphilis in case of the penicillin allergy. Because as we mentioned before, the penicillin G is the first line to treat the syphilis, single dose, but if there is allergy, we can use the tetracyclines to treat the primary and secondary syphilis. This picture here shows the rash that comes with the Borrelia infection that caused the Lyme disease. This is what is called the bullseye of the erythema migrans of the Borrelia infection. Now let's talk about the adverse effects of the tetracyclines. So first of all, GIT upset in form of abdominal pain and nausea and vomiting. That's because the tetracyclines are very irritant to the stomach, so they cause these side effects. They also may cause esophagitis, so it is advised that the patient take them in upright position with water to reduce the risk for developing esophagitis. They also might cause super infections because the absorption is incomplete, and some of them would go into the intestine and would kill the beneficial bacteria in the intestine and would leave the resistant ones like the Clostridium difficile, the fungi, some type of fungi, or the Pseudomonas, and those would become dominant and would cause super infections. The tetracyclines also cause, they also make complexes with the calcium, calcium, and that would lead to them to their deposition in the teeth of the growing child and would lead to abnormal teething. They also deposit in the bones of the growing child and they cause temporary growth stunting. In the pregnancy, they cause bone malformation in the fetus, so they are contraindicated, and they also contraindicated or limited. They have limited use in kids under 8 years of age. They also cause liver side effects, but those are rare, and they cause the liver, lead to liver cell failure, so liver cell failure, and that's by direct injury to the liver cells, and will lead to elevation in the enzymes of the ALT and AST, and they also cause liver side effect in form of biliary cirrhosis. They lead to swelling of the liver cells, and swelling of the liver cells would lead to blockage of the bile duct or the bile canaliculi. So as we know, the liver cells are in this way, and there is a bile duct in the beside them, and then when there is a swelling, this would lead to blocking of the bile ducts and would lead to biliary cirrhosis in the long term. And this would lead to increase in the enzyme ALP. We also have kidney side effects, and those also are rare. The tetracyclines lead to blocking of the V2 receptors in the collecting duct of the nephron, and as we know, the V2 receptors are controlled by the ADH, the antidiuretic hormone. When the ADH is working on the V2 receptors, this will lead to reabsorption of more water, and if the V2 receptors are blocked, this would make the ADH useless and would lead to polyuria and a nephrogenic type of diabetes insipidus. So the first side effect for the kidney is the nephrogenic side effect due to the blockage of the V2 receptors in the collecting duct, so nephrogenic DI. They also lead to the killing or the death of the proximal convoluted tubule cells, and that will lead to polyuria and losing of the electrolytes, and that will lead to the Fanconi syndrome. So also another side effect for the tetracyclines is the Fanconi syndrome due to proximal convoluted tubule cells death, and that's only happen with the tetracyclines that are outdated. So happen with outdated tetracyclines. The tetracyclines also cause photoallergic reactions. So photoallergic reactions, that's because the tetracyclines are photosensitizing agent, and photosensitizing agent make people more susceptible to sunburn, and it is advised to wear sunscreen while intaking the tetracyclines. Tetracyclines also cause vestibular dysfunction. So vestibular dysfunction is in form of dizziness, and vertigo, and this happen with the doxycycline and the minocycline because those would concentrate in the endolymph and the perilymph and cause the vestibular dysfunction. And finally, the tetracyclines cause pseudotumor cerebri. So pseudotumor cerebri, which is a form of benign increase in the pressure inside the skull, and this will lead to headache and blurred vision. And with that, we reach the end of this video. Thank you guys for watching. Please like and subscribe and share this video, and see you in the next video. Peace.